So recently, we actually published a study. In clinical trials, essentially, we have an acute intervention. It could be blood pressure reduction for intracerebral hemorrhage. It could be thrombectomy for acute ischemic stroke. But we never really focus on or standardizing the rehabilitation that follows. And there's obviously data to suggest that rehabilitation or dedicated rehabilitation makes a difference on patient outcomes. So while you have a acute intervention that you have standardized, but you have made no effort to standardize the rehabilitation that follows, and you're confounding the benefit of your acute intervention by this heterogeneity in the rehabilitation that follows for the next 3 months. And I think there is ample data to suggest that if you do a structured rehabilitation, you would actually have a better outcome. But in clinical trials, we simply say that whatever is rehabilitation that's acceptable by institutional standards, or maybe just follow the national guidelines, but we don't make any more effort to specify further or even monitor. So we always monitor compliance to the acute intervention. We always monitor how effectively the acute intervention was delivered, but we never really monitor what happens with rehabilitation. And I think that if you look at studies, so in our recent publication, what we found is that when you actually had a higher level of standardization of rehabilitation in acute stroke studies, you had better outcome of these patients overall. So there is an element of a strong element that influences patient recovery, and it's not somehow has not been addressed properly in clinical trials or even in practice, where you see a large amount of heterogeneity in rehabilitation strategies. I think part of it is driven by cost. I know in United States, insurance status becomes a big issue, that the quality of rehabilitation that you will receive will partly be determined what your insurance status is. So not necessarily the level of neurological deficits or what may benefit you the most.